there's some misperceptions surrounding pain management these days with news stories and the opioid epidemic that has been identified, has been declared a national health crisis by the current administration. And what I'd like to make clear is that there is a difference between pain management and opioid management. Any pain management certified physician should not only have opioid management as an option for their patients. This epidemic started because pain management physicians and primary care physicians were trying to help their patients, and often that involved escalating doses of opioid medications to better control their pain. Well, what we've come to find out is that that doesn't necessarily correlate, meaning that some patients with the highest pain scores and the highest disability ratings are actually the patients on the highest amount of pain medications. So we found that just by escalating the pain medications, we weren't actually improving functionality or quality of life in a lot of these patients. And that's led to a shift in treatment of these patients from primary care offices to specialty offices, offices such as mine, where we can offer not only opioid management, but also interventional therapies and non-opioid medications. Any patient, after undergoing a full workup, should have multiple options as to what they would like to pursue for their care. Opioids is not the only option. Sometimes it is an option depending on what their pathology is. Unfortunately, we're not at the place in medicine right now where we can fix everything that's wrong with the body. And sometimes, unfortunately, that leaves chronic pain, daily debilitating pain, as a reality for a large number of patients. There are millions of patients across the country that are in chronic, daily debilitating pain. So pain management is viewed, in my opinion, the same way as a cardiologist treats you for your blood pressure, an endocrinologist treats you for your diabetes. It's morally and ethically an obligation of ours to also treat people for chronic pain and debilitation, because they deserve to have the same quality of life and the same enjoyment of life as the rest of us do. And that may involve opioids or it may not, but unless you have that evaluation and see what your treatment options are, you may be living with more pain and more disability than what you really need to live with. Life's short. Our goal is to not just get you in less pain, but to get you more functional. And unfortunately, because of this national crisis on opioids, a lot of people feel that pain management only has opioid management to offer, and in reality that's only one very small portion of what we can offer. And unfortunately, a lot of patients are embarrassed when they say that they have chronic pain or that they're going to a pain management clinic. And what I'd like to reinforce is that, fortunately, that's not necessary. You wouldn't be embarrassed to go to a cardiologist because you've got heart disease. You wouldn't be embarrassed to go to an endocrinologist because you have diabetes. Unfortunately, as I mentioned, we can't fix everything that's wrong with the body, so chronic pain is a very real issue for a number of people that limits their quality of life and their enjoyment of life. And so by coming to a pain clinic like ours that has board certified pain management physicians who have had all the credentialing done all the appropriate training, we can offer options that a primary care specialist just isn't trained to do, the same way that I'm not trained to do everything that they do. And so I just want to make sure that patients don't feel embarrassed by coming to a pain management clinic. We offer services the same as any other specialist, and that patients realize that they're not alone. There are literally millions of people every day living in chronic, debilitating pain. A percentage of those are fortunate enough to see a good pain management practitioner that can improve their quality of life, but unfortunately a lot of them suffer at home and don't do the things they want to do. They don't go and see their grandkids' graduations, they don't go to family outings, they don't spend time with friends on the weekends because they're afraid they're going to hurt too much to do it, and they don't want to be laid up in bed, for lack of a better term, moving forward. And those are the kind of patients that we want to see and the kind of patients that we want to help. We want to give you back your functionality. We want to give you back your quality of life. That may or may not involve any quote-unquote pain medication, opioid medication. There are other medications we can use that are safer, that don't have the same stigma that pain medications have, as well as the usage of interventions. There are patients that come into me and with a few simple interventions tell me that they feel like they're alive for the first time in years and they're able to do things they have not been able to do in 5 or 10 years, and they're very thankful for that. And I think that that is a service that patients need to know is out there if they're suffering from this chronic debilitating pain, and something that we're happy to help them explore, and that they really shouldn't feel bad about needing that help.